Good evening and welcome to Pacific Science Center's virtual Science in the City. I'm Zita Strickland and I am pleased to be your host for tonight's virtual Science in the City talk. Tonight's event is presented by First Tech Credit Union and we are so pleased to have their support. First Tech is committed to supporting the next generation of leaders, thinkers, and innovators and has been a longtime partner of PacSci. Joining us tonight is Ingrid Van Veen, Account Manager at First Tech.
Thank you, and good evening, everyone. On behalf of First Tech Federal Credit Union, I would like to extend a warm welcome to everyone joining tonight. First Tech prides itself on a people before profit and people helping people mindset, which includes our employees, our members, and the communities we serve. These values underlie First Tech's proud partnership with Pacific Science Center, as together we are invested in the future, which includes your children. Our partners provide programs and services for children and families, ensuring that children have the tools they need to learn, be healthy, and succeed. We are committed to provide access to STEM education in underserved communities, underwriting new programs to address the most urgent needs of children and families, and driving medical research and innovation in care, which is why we are honored to be sponsoring tonight's event. Thanks again and have a great evening.
Well, thank you so much, Ingrid, and thank you to First Tech for your support. Science in the City is also made possible with generous support from Jeff and Carmen Barr, and additional support comes from more than 1,500 individuals, companies, and foundations that donate to Pacific Science Center each year. Now, after tonight, this Science in the City will be viewable on our YouTube page, along with many of our other past Science in the City talks. You can learn about pizza-making robots, Martian landers, or even the Science of Climate Pledge Arena in advance of the Seattle storm season starting soon in May. All of these talks can be found in our Science in the City playlist on PacSci's YouTube page. In addition to that, on our YouTube, on our web pages, you can also find hands-on activities that can be done at home or in the classroom, and information on our live and interactive virtual field trips, which are great for schools, classrooms, and other places where curious minds gather. You can learn more about all of our programs at pacsci.org. I want to thank everybody for tuning in tonight and for being curious with us. And thank you to everybody who made a donation at registration. If you hadn't yet and would like to donate, you can at pacsci.org/support. Your donation helps us ensure that curiosity never closes. Now, tonight we are discussing COVID-19 and specifically the COVID-19 vaccine for the youngest members of our community, kids under the age of 5. And we really do want it to be a discussion with lots of opportunities to share your questions directly to our guests. Now, to ensure that you are watching in real time, which makes it easiest to ask questions, just check the bottom left corner of your YouTube window. Right next to your sound and your volume button, you should see the word live. And if it's lit up with a red dot, you are watching live. If not, just click on the word live and you'll get caught up in real time. Now, throughout tonight's discussion, you can share questions with us in 2 different ways. Firstly, you can add your questions directly to the YouTube chat box right on your screen. If you don't see the chat box and have the ability to add a question, it just takes a moment to make a YouTube account so that you can type in your question. But you can also add your question to an online form. No account needed. Just click the link that we are going to put in the chat and then just type in your question. These questions will then be shared directly to our guests, and you can get answers to everything you've always wondered about COVID vaccine for kids. In fact, if you want to use those chat options now, let us know why you're watching tonight. I'm assuming you're probably viewing because you are thinking about vaccines for a young person in your life. If that's the case, or you have another reason, go ahead and put in the chat who you're watching tonight for, maybe how old they are, and we'll take a look at some of those responses. Again, you can put them in the chat box right on YouTube, or into the Google form. We are glad that you are watching with us tonight. We hope that all your questions will be able to get answered by our two spectacular guests. In fact, I think it's time now to go ahead and meet our guests. We have two experts joining us tonight, Dr. Michelle Andrasik. She's a clinical health psychologist working to engage marginalized communities in clinical research with a focus on ongoing vaccine trials for HIV and COVID-19. She's the director of social and behavioral sciences and community engagement at the Hutch's HIV Vaccine Trials Network and the COVID-19 Prevention Network. Her areas of expertise include community-based participatory research approaches, implicit bias, historical trauma, health inequities, and qualitative methods. Also joining us is Dr. Ben Danielson, clinical professor of pediatrics at the University of Washington. Now, for 2 decades, he was the medical director at the Odessa Brown Children's Clinic, which serves mostly low-income families in a historically Black community. He also serves on various boards of groups dedicated to health issues, including chairing the Governor's Interagency Council on Health Disparities and co-chairs King County's Racism as a Public Health Crisis team. The unifying thread in Dr. Danielson's activities relates to promoting well-being and dignity, especially for communities who have been pushed aside. Drs. Andrasik and Drs. Danielson, thank you so much for joining us tonight. So happy to have you here. And I know there are questions that you are going to be able to help us answer. So thank you for joining.
Thank you for having me.
It's an honor to be here, especially with you tonight.
Now, you each are so much more than what I very briefly shared in your bios. So I would love each of you to just take a moment and introduce yourselves a bit beyond what I've initially shared, and also how you connect with this idea of vaccines for kids, both professionally and personally. Let's start with you, Dr. Andrasik.
Okay, great. Well, I've spent most of my adult life working in HIV prevention for personal reasons and for a passion to see an end to the first pandemic that I encountered in my lifetime. About 11 years ago, I switched from doing mostly community-based HIV prevention work to a focus on helping to find a vaccine for HIV and working with the HIV Vaccine Trials Network. In March of 2020, we were asked to pivot our focus from HIV vaccines to the COVID vaccines, and it's the infrastructure that was created by the NIAID funded networks that really helped us get the COVID vaccines up and running so quickly. And then my own personal experience with vaccines is, I've been vaccinated since I was a baby. And I personally think that, vaccines are one of the top reasons why we are living as long as we live and living, fairly quality lives, depending on your demographics and so forth. But I definitely, and the reason why I switched from HIV prevention at the community level to HIV vaccine work is because I truly think that we're not going to see an end to HIV unless we find a vaccine. So I am incredibly committed to vaccine work and very passionate about it.
Thank you. Dr. Danielson?
Well, I'm still taking in deep appreciation for Michelle. Can I call you Michelle tonight? And I picture all the young people out there who might say, wow, she looks like me and I want to be just like her when I grow up. It's very inspiring to know that there are folks around us with such dedication and a sense of purpose and who are doing things that help change the world. So I can't talk about anything about myself without just appreciating everything about the company I get to keep. I think sometimes about a different introduction than the stuff that shows up on our titles and things like that. So I will say I'm a product of a brief time in the foster care system. I was rescued by an incredible single mom who raised me in inner city Washington, D.C. We didn't have much resource financially, but she taught me and my sisters a strong appreciation for the sense that we need to be connected to each other and do work to help support each other. And that through the chance for an education is the chance to experience a life that's full of different kinds of rewards. And so she always encouraged me despite my bad behavior. And I ended up eventually kind of becoming a doctor and coming out to Seattle, and went through all of those things that give you doctor degrees. And then I started working in the Central District and learned from incredible elders, amazing Black women, about what it meant to support and serve and be useful and be a learning person in a rich and brilliant community. And I've been so appreciative of being able to feel part of that historically Black community in Seattle for a while. I'm so amazed at what this country has been able to do in terms of developing and generating a vaccine in an incredibly fast timeline that was amazingly safe, amazingly effective, and then getting it out to us and giving us the opportunity to really protect ourselves during a time when I think every part of our sense of safety and health has been challenged. And so I feel very glad to be part of this conversation today about the importance and value of vaccines, and also just to take time to appreciate the amazing communities around us.
I think that's something that has come out so strongly in both of your work, is that connection to community, to talking with people, and to really helping people that are curious and want to know more for themselves and their own health decisions, but also for their neighbors and for that larger sense of community. And I'm so thankful that you're both here tonight to address these questions. We had quite a few people submit questions when they registered, and they really are questions that are trying to make the best decisions for their youth, important in their life, but also this wider, looking towards the future and looking wider beyond their household. And so I think that the two of you are just such great ambassadors into this world of medicine that sometimes is a little hidden and often a little confusing. And thank you so much for being with us tonight. Can we just start with just a brief regroup and a regrounding of COVID-19? It seems like a funny question to ask because we've been living in it now very deeply, coming up on our 2-year anniversary right now. But let's just go back to the kind of the basics of what actually is COVID-19 and how is it impacting our community here in Seattle. I think, Dr. Danielson, I may start with you for this question.
I hope we can sort of ping pong back and forth. And, I actually want to start with saying we're going to keep learning so much about COVID-19. We are at a time where we have this chance to have really important ways to stay safe and healthy, lots of different ways for us to really look out for ourselves and look out for each other during this time. And we're still going to keep learning more about COVID-19. When I start to think about it, and then I'll hand over to you, Michelle, I think about this idea of a virus, this very small entity that is really, really good at getting other things to do a lot of work for it. And the best way to do that is to get into the bodies, in this case, bodies of people, and replicate, which means make more of itself and use some of the resource there, and trigger in your own body a big response to try to fight it off. And the combination of what the virus does to you and what your own body does become so many of the hard symptoms that we see, the fevers and the breathing troubles, the coughing, the miserable feelings, the symptoms that can turn into long COVID and last for months and months and months, the strange symptoms that can happen and that can be really also really impact it really hard, like losing your sense of taste or smell. All of these things are really this almost like this battle going on in your body, trying to eliminate this virus that doesn't have a lot of structure itself, so it uses yours. It's kind of greedy and makes you feel sick while you're trying to get rid of it. And it keeps changing. It's really good at changing its shape and form, finding new ways to continue to be effective at infecting. It's a really important reminder to me that that our natural world is full of things that have lots of different ways of adapting and changing. We do too as humans, which is why we're getting through this time and why there's nothing that will really keep us down. But other beings like viruses have a lot of adaptations too.
Yeah, well said. I think the only thing I would add is I think, given our reality now where we have so many people among us who are immunocompromised, it really brings to bear the importance of community level protection. Because with the number of people who are immunocompromised, who are not able to mount the immune response needed to be able to effectively control the virus, it becomes really a challenge. And, one of the theories about some of the variants of interest, Omicron as the latest one, is, that the viruses being what they are and trying to improve their existence and become stronger and ensure that they survive, take advantage of immunocompromised systems and learn their ways around the immune system. I mean, they are trying to survive. And I think that that's a really critical point when we're thinking about why it's so important to protect community and not just ourselves. And something that I hope we have gotten out there in terms of messaging for communities.
That's such an important point, Michelle. I mean, an immune compromised, meaning like you can't fight off infections very well. That can show up for all kinds of reasons, right? You can't necessarily just look at somebody and know whether they're immune compromised or not. So it's not always just that you can kind of stay away from someone or know if you're in the grocery store whether they're immune compromised or not. But there are lots of different things that can make you immune compromised. Even just in some ways, just getting advanced in age can be that, right?
Being on cancer meds. Or other medications, so lots of reasons.
You really think about the person who's had a long-term condition that affects their ability to protect themselves, and how many ways, even before the virus, they've had to be really, really careful, but how now, not only do they have to be really careful, but they have to rely on us to be careful too. And what I like about that, I don't want anybody to feel worried or sick, but I do appreciate that reminder that that we're all in this together, that the things we do, the choices we make, the way we walk in the world has an impact on each other. Even if we don't know or see each other, we still impact each other. There is something special about that sense of connectedness, isn't there?
Yeah.
One of the ways that we've definitely been hearing that idea of community and we need to take actions to protect each other has been in vaccines and that concept and idea of herd immunity. Let's speak, before we get into vaccines specifically for the youngest kids, Let's just touch a little bit on what is the goal of the vaccine for COVID for just us as adults in general, and what is this idea of herd immunity and community?
Well, I think COVID sort of throws herd immunity for a loop. It's really complicated. And I think that thinking in terms of herd immunity is not really relevant when it comes to COVID because of the, the mutations that we see and all of these variants of interest that we see with COVID. So I won't go into herd immunity, but I do think that what is really critical in terms of COVID and protecting ourselves in terms of vaccines is that the vaccines are incredibly effective. They are more effective than any of us could have possibly hoped for.
Mm.
We were hoping for efficacy that looked like the flu vaccines, which are around 50 or 60 on any given 50 or 60% on in any given year. And the fact that we had vaccine efficacy, in the 80 percentile was just, I personally couldn't believe it. I was like, oh my gosh, this is like the best case scenario. But I think when we talk about efficacy, it's really important to understand what that means. The vaccines are incredibly effective at keeping us out of the hospital and keeping us alive. That efficacy is not talking about the vaccine's ability to prevent infection. Although there is some efficacy with infection as well, but it's not in the same ballpark as preventing hospitalizations and preventing death. And so when we talk about that efficacy, we can see that since the vaccines have been implemented, we have seen sharp declines in death and hospitalizations among people who are vaccinated. And I think that that's really a critical point, especially, with the some of the news that's coming out about the children's vaccines now and its inability to prevent infection. That's not what the efficacy is talking about. It's talking about the ability to prevent hospitalization and prevent death, which is really important for, people who may have pre-existing conditions, or people who, may be older and have other challenges with their health. And I think that, and even for people who are completely healthy, who have no pre-existing conditions, we've seen that long haul COVID, is a real issue for a lot of people who were healthy beforehand, including children. And then the MIS-C, which is the multi-inflammatory system. Is that what does that stand for, Dr. Danielson? You probably know better than I do. I'm totally spacing out.
Multi-system inflammatory disease. Yeah.
Thank you. Yeah. So we see children who were totally healthy, had no pre-existing conditions, in the NICU with MIS-C. Now, granted, there aren't large numbers, huge numbers, but I would argue that any child who ends up in the NICU is it's significant, and that's not something that you would want to happen. So the vaccines, we know, prevent these things from happening. And I think that that's really the key for me, and what I base my decisions on.
I'm so glad you frame it that way, because I don't know if any parent out there wants and hopes for something that is just complete and perfect protection for themselves, for their loved one, for the kids, for their neighbors. You want a guarantee. It's at least what you hope for when fear and the presence of so much illness is around you. And you got to be real and understand that some amazing healthcare breakthroughs have happened with the vaccines and with the other measures that we use to stay safe. But it's not the guarantee that you're just never going to get sick. That's just not the way this all works. It is really helping to make sure that fewer people go to the hospital. And let's just think about that for a second. That means not only is it benefiting people who have COVID themselves, but also the person who needed heart surgery had nothing to do with COVID. It means the hospital bed is free for that. It's freed up for that. Sorry, hospitals, I didn't mean that was free, but it was freed up. And that the other kinds of care that you might be in an emergency room for, you can get that care. The physicians, nurses, and other care providers are able to attend to those issues that we all face all the time by not overwhelming our system. Yeah.
I think that's such a critical point because our medical system has been really taxed by COVID. And, not only do people have to delay elective surgeries, but, some life-threatening issues where there's just no room in the hospital for them because this system is so overwhelmed by COVID patients. And, that's such a good point, such a really important point.
So before we get into more questions about the vaccine specifically for kids, I just want to remind everyone watching that you can ask your questions of our two guests in the YouTube chat or in the link that's in the chat box. Ask any questions you have, and we will relay them here to our speakers. So speaking about the vaccine, we've heard a lot about how this is a messenger RNA vaccine. So it's instructing your cells basically on how to build that immunity so that when COVID-19 actually shows up, your immune system is already prepped and primed and knows how to respond. Are there other vaccines that we've been using that use that same style of messenger RNA?
Yeah, there is an Ebola vaccine that uses that messenger RNA. There are several vaccines in development now. The messenger RNA has made such a splash with COVID that there are several phase 1 programs currently recruiting that are looking at using the mRNA technology for an HIV vaccine, for tuberculosis vaccines. There's one, I think, under discussion with regard to malaria. So I think, one of the great things about the mRNA technology is that it also allows for expediency. And so it really is very exciting for those of us who've been working to find vaccines for diseases that have really been incredibly evasive, particularly HIV. And so we're really hoping that this can open up a pathway to get us to an HIV vaccine quicker.
So it's going to benefit other developments of other diseases. That's a great thing about science, isn't it? Mm-hmm. That somebody sees one thing that's really working well and finds a way to apply it to something else. And you can credit the work that so many incredible doctors did to get the scientists to get the COVID vaccines going for, because they were based on a bunch of other great discoveries before them, and they'll be basing this work on other great applications down the road too. It makes me really excited. Like, I don't know what young person out there watching or parent of a young person knows that their child is going to grow up to be, I don't know, taking your baton, Michelle, if this is like a relay race for better health and cures, and taking the things that you learned and carrying it for their next 100 miles of discoveries and innovations and creations and things that are going to continue to make the world better and better. I just think that's really exciting. I also appreciate that the way these vaccines work, and this is true of their messenger RNAs, if they borrowed a different bug and made it tame and used it to deliver, the right message also. If it's grown in egg cells or anything like that, their job is to stimulate your immune system to work well, which is why that point you made earlier, Michelle, about like if your immune system is not working well, if it's like we say compromised, it's really hard for a vaccine to work well for them. But it's also true that these vaccines aren't coming in to change your body. They're not coming in to like replace anything in your cells or reprogram your cells completely. They are deliveries. They just knock on the door. They say, "You guys need to go fight that right there," and they kind of encourage your whole immune system to just jump into gear. And so you're doing it. Your body is doing it. Your body is protecting you. Your immune system, all the things that are you about you remain you, and you do the work actually of kind of fighting back this virus. And I like that idea too, that it's us doing this. I love the technology, but it's still us we're doing the work to keep ourselves safe and make sure that the people we care about are safe too.
Yeah, and it's so exciting that the immune system and immunity is just so incredibly exciting. And one of the things that we're really trying to do is figuring out ways to make other people excited about the immune system, so
I'm excited.
because I'm like, we are, if you think about our bodies as a garden, and where we are this beautiful garden, our immune system are the gardeners, taking care, getting rid of the stuff that we don't need, making sure that the stuff that we do need is working well. And then the vaccines are sort of like these master gardeners or the trainers who come in because you're not quite sure what to do with this part of your garden. And sometimes you need like outside help. Yeah. To really get it going. So, and I think it's just so exciting, and it can get really complicated. And, you start talking about B cells and T cells and macrophages, and it can be really overwhelming. But the way that our immune system works is just so incredibly exciting, that we have like all of these things going on in our system to make sure that we are well.
Right.
And it's just really amazing.
I'm using your garden analogy here for this next question. So if it falls apart, I'm blaming you because you started me on this. So I've got this immune system. It's my garden. It's the gardeners that are helping to tend the garden that is my body. Does a kid, like a 4-year-old, are their gardeners as good as my gardeners as a full adult? Or does that vaccine, those master gardeners, have to have a different approach because the immune system in a little kid is just not as developed or not as the same as an adult?
You know what? I'm going to start with a little bit of a counter story, and then, but all of this stuff is interesting because it's not just always like just one straightforward story, right? As a pediatrician, I really have incredible faith in the amazing, robust power of the immune system of a younger child. It puts my immune system to shame. I know that, and it is actually looking for things to stimulate it, to tell it what is out there in the world that it needs to think about really being protected from. So, this is also being a little bit too simple, but in so many ways, I think not only is the immune system in a child, like say this 4-year-old, often just way more robust than anybody else on this Zoom right now, but it's also way more ready for the way vaccines work. And I think that's, sometimes we want to say that young people are somehow less able because they're smaller or something like that. And I just need some young people power to say that young people have amazing abilities and have talents and skills that partly because they haven't been all refined and worn and done and used for a long time, just all the machinery works super duper well. So that garden, that 4-year-old garden, as the greenest, freshest plants you could hope for.
Okay, so I'm hearing you say that the gardeners are maybe a little more open-minded in the 4-year-old and better able to receive knowledge from the master gardener and really learn.
All
And
right.
that's probably why we do vaccines for kids, because that's the right age to get those immune systems trained up.
But now we're
Dr.
talking
Danielson,
about
why then is that 4-year-old sick all the time?
Well, they're every week they are teaching their immune system, right? You, as a parent, everyone knows this, but you actually don't want your child to never get sick. I just used a double negative there, but you don't want your child to never get sick, because that would mean your child was just not having the opportunities that its immune system needs to both practice having a good response and maybe just as importantly, practice then turning down that response after like a threat has gone away. And then also like start to develop a little library, like a little library of memories. So near that garden are some gardening books that are references for the kinds of things that you need to think about, which worms are helpful for the soil and which bugs are going to eat your leaves. And those are, in some ways, those are like this catalog of different viruses that we get exposed to over the course of our lives. And sometimes the first time we get exposed, the symptoms are a little stronger. So the nose runs a lot heavier, maybe in the 4-year-old than it does in the 40-year-old. But the immune response is also really, really, really strong and good. And that set of memories is really, really important, especially for the kinds of viruses that aren't going to cause them too much harm or cause people around them too much harm. So a lot of medicine is about deciding oh, this seems like this is a common cold and you're going to be okay. But this other thing, this measles thing, this COVID-19 thing, we need to be much more worried about that. And these are the things that we need to provide vaccines for.
Okay, so we've got this vaccine, these master gardeners that come in. We developed it first for adults. So how is it different than for the 5 to 11-year-olds, the 12 to 16-year-olds, and the under 5?
I'm just glad that this is a time in medicine where we don't just say kids are just small versions of adults, right? We actually do the extra work to make sure that the science is right, that the dosing is right, that the approach is correct. And we actually try not to make assumptions about a child's body based on an adult's body necessarily. And that takes extra time. And that's sort of why I think we didn't see vaccine for all ages kind of come out all at the same time when the vaccines were first available.
Yeah. And if you think about it, last spring, when everyone was focused on the adult vaccines, in the background, there were several phase 1 and 2 studies going on looking at dosing for children. And those weren't getting very much attention, but they were happening in the background, trying to figure out what dosage would be appropriate for 5 to 11-year-olds and what dosage would be appropriate for under 5. And they're looking at the immune response, they're looking at side effects and safety. And all that was going on in the shadows, and in the background, because everyone was so focused on all of the efficacy trials that were moving forward for adults. And, I think what you state is so true. We are so fortunate to be in a time when those extra steps are taken and that we have the knowledge to understand that we need to have formulations that are appropriate for children and looking at the immune response. It's not just about weight and BMI and height in children. I mean, it's about the immune response and about the side effects that children are going to experience when they have the vaccine.
So, I mean, we see this in adults where there's just adults come in a whole variety of sizes. And a 12-year-old also, there's a huge range in the size and the weight, the BMI of a 12-year-old. When you have 10 different 12-year-olds that are all getting the vaccine, are they all getting the same dosage, or is there some tailoring that's going on to each individual recipient?
Not all the way down to individuals. I don't think there's tailoring that happens all the way down to that level. It's just really to make sure, just like Michelle said, that it's not so much about your weight or your height, but for different ages and stages, your immune system kind of responds differently. Your organs process things differently and filter things differently and all that kind of stuff. And so that's what's much more important. So just because you see a tall, lanky beanpole like I was when I was 10, maybe, getting the same dose as a really petite little small person who's about the same age, it actually makes good science and good sense. It's important though still to also appreciate that this process, there's a reason the process of figuring out doses at different ages has taken a while, hasn't it? Compared to maybe the speed with which the first set of vaccines have come out. And it makes me think about two things. One is that a whole lot of this stuff is happening in a very open way. Like we actually get to ride along and see like every step of things happening. So we're not just way out at the end of the line waiting for the vaccine to come out. We're actually, if you want to, you can hear and learn about every step. And when we've had times when the vaccines were almost ready to go out and they said, oh, wait a minute, you know what? This is okay in the youngest kids, but in the kids it's just a little bit older, it actually might not be the right strength. And so people pulled back and did some more studies and tests. That takes time. You get to hear every bit of it, which I know for some people makes it feel like more uncertain somehow. I can understand why somehow people can sometimes experience that as more feeling more like it's a roller coaster ride or bumpy ride or something. But it's partly because you're seeing every bit of it, every bit of the whole thing playing out. And I, for one, makes me actually feel more trusting to see all the switches and turns and decisions and subsequent decisions and next decisions. To kind of hear about that actually helps me feel like everything is happening the way it should be.
Mm-hmm. Yeah, we're definitely seeing science as a process, as a verb in real time right now. I think it was just Monday that I saw an article that Pfizer had postponed their FDA request for kids under 5, wanting to look again. I think this one was the number of dosages. Is that correct?
Yeah, I think that's right.
Yep.
So I think the big question on every parent's mind is, when do you think that vaccine for under 5 years old is going to come out?
You know what my answer is going to be? When it's safe and when it's the right time. Because I'm not going to pretend to predict. If I were predicting a time, that would tell me that they weren't actually responding to new information. So actually, what that tells me is that they'll be out when they've done all the due diligence that you're supposed to do to protect our beautiful young people.
You're not going to give me a date, are you? So we've been talking a bit about really the process of these vaccines for kids from kind of a clinical point of view. Let's tackle it now from a little bit of a parent's point of view. And Dr. Andrasik, I know you are coming to us with a couple of different viewpoints on this.
Yeah, well, I am a parent of 2 beautiful daughters, a 13-year-old and a 9-year-old. And so my 13-year-old was 12 when the when the vaccines for children came out. And so at that point, we were all vaccinated with the exception of my 8-year-old, which she quite loudly let all of us know was not fair. And how could I let this happen if I'm working on the vaccines, that everyone else gets vaccinated except for her? So, she wanted to join the Pfizer study. She knew that the Pfizer study was happening, and she was like, I want to get vaccinated. I don't want to feel, she was very sort of anxious about not being vaccinated. And I said, well, it's a study, so we don't know if it actually works yet for people your age. And she's like, well, I still want to do it. And so we had to have the conversations about blood draws, because that is a major, a major challenge, I think, for young kids, blood draws. So we watched a couple of YouTube videos about blood draws, and the blood draws have honestly been the worst part about it still, because a blood draw is a blood draw. Whether you're 8 years old or, in your 40s or 50s, a blood draw is a blood draw. But, I was excited to have her be part of the study. I think that it put me at ease knowing that she was vaccinated. I have to say, as a parent, even though I did not know for a really long time if she was in the vaccine arm or the control arm, I was like, well, there's 2/3 of a chance that she actually got the vaccine. And when we got the call unblinding us, my husband and I literally danced. We were walking home and we literally danced in the street, knowing that she had been vaccinated for 3 months at that point. And so I think that it's a wonderful opportunity that she's had to sort of see science as a participant in a clinical trial. Personally, as a parent, it made me feel a lot more comfortable. It really changed our behavior as a family in terms of how isolated we had been for such a long time, just knowing that, okay, well, maybe all of us are vaccinated and we can venture further out with our masks on, still, maintaining some physical distance. But it really did change our entire perspective. And then when we found out that she was vaccinated, it was, like I said, a thrill. And then a couple of months later, she found out that they were getting boosters. And so as an 8-year-old, she's like, wait a minute, they didn't have. So does that mean I have to have more blood draws? And the answer to that is yes. You have to have more blood draws. So now, she's had her booster as part of that study and her blood draw that went with the booster. And, besides the blood draws, I have to say that it's really reduced her anxiety quite a bit to be in the study and to feel as though she is doing something for people her own age, and to feel like she's part of it, which is really, makes me as a scientist pretty happy too. That she's really so excited about science and really interested in, giving back to her community. And,
Wow.
I've got to see firsthand, the impact of an experimental vaccine for children her age. She had no side effects except for, local swelling and redness. But other than that, she had no side effects. And it was, pretty exciting because she got to keep her diary and, the 7 days post-vaccination, you have to report every single symptom that you've experienced. And so she got to do that and got to learn about all the possible symptoms and side effects from a vaccine. And we got to have the conversations about how these symptoms are similar to the symptoms you have if you actually have the illness, and why that's so, what your immune system is doing to generate those symptoms. So it's been really incredible for many, many reasons. But most of all, as a parent, I have to say it made me feel very secure in knowing that she could potentially be vaccinated as well, like early on when it was so unclear. And I know, Ben, you being so close to the epicenter, I would hear about the kids who were in the NICU and the kids who were having Miss C, and it felt helpless sometimes as a parent, not knowing, and our kid, especially when kids went back to school.
Yeah.
And, knowing that, yes, they're wearing their masks, but they're also kids. And, sometimes the masks fall down and then they have to eat together, even though it's outside. So, you go through all of these, scenarios as a parent. And it really, helped me feel a lot less anxious, I have to say, about the whole thing.
Mm-hmm.
I've never known anybody who's been part of a clinical trial like this before. So this is really interesting. Are her blood draws continuing? How long?
She's had 3 of them. So after each vaccination, they do a blood draw to see, to measure your immune response. Mm-hmm. So, not directly after, but at a follow-up visit. And one was directly after the initial vaccination. They had a blood draw initially after the vaccine. But really, it's to measure your immune response. Everybody talks about antibodies, but there's so many other things that you can look at: B cells, T cell responses. So we had an opportunity to talk about all of that too. Like, why do they need so much blood? Well, this is what they're looking for, to see, if your immune system is doing what it needs to do to protect you from, getting really ill. So, but it still doesn't make the blood draw any better.
I hope you thank her for what she's doing.
Yes. She's a hero. She is a shero. I tell her that every day, that she's a shero and that she should be very proud of what she's doing. Yeah.
She should get extra dessert too, but that's not my call.
No, she does. She gets ice cream. she gets to choose actually what she wants after each blood draw, and usually it's ice cream.
As she should be able to choose. So I love that you have gone, as a parent now, had the children that got just the regular vaccine and then those in trials. Were you told to watch for anything different? Or were there any particular side effects in either situation that parents are being told or should be looking for?
Mm-hmm. Well, I think, fatigue, like really, really over the top fatigue was one of the things that we were told to look for. Excessive pain. You don't want to have excessive pain, and body pain, body aches as well, or some of the symptoms we were told to look for. None of them happened in either one of our children. My 12-year-old, after her second shot, she also got the Pfizer vaccine. She was really tired for a day, but that was pretty much it, and then, of course, the local symptoms. And when I say local, I mean at the injection site. So swelling, redness, pain. But yeah, the things we were told to look at, and there's a whole list of symptoms that they give you. And I mean, you go through this very, very rigorous consent process. And then every day, they ask you to fill out the diary, the vaccine diary, for 7 days following your vaccination. And they have a list of symptoms, like, has your child experienced fatigue? And if you say yes, they're like mild, moderate, severe. And then they give you definitions of what mild, moderate, and severe actually mean. And if you state severe, a warning comes up saying you need to talk to your doctor. You need to get in touch with your doctor right away. And I know that because I mistakenly put in severe one time when I meant moderate, and it gave me the warning on the screen, like, call your doctor right away at this number if they're having severe pain. So yeah, there's a whole list of symptoms that you go through, and every night you go through the diary, and my daughter and I would sit together. I had to take her temperature every day also and record the temperature. Right. And if I reported any pain or swelling or redness, I had to measure it and report what the measurement of that redness was, of the swelling was. So very, very detailed explanation of the side effects, so that they, not only for the health of my child, which made me feel good, but also so that they have that data so that they can let other parents know what to expect.
I think you both earned your ice cream.
Yeah, that's all the work.
So when we're talking about side effects, everything that's been mentioned so far all has a short duration. It's, you said there was a diary for 7 days. It was tiredness for a few days. One of the things that I definitely have heard from people that I know is concern about longer term effects of the vaccine, especially related to fertility, to interruption of menstrual cycle, that for a 5-year-old is still several years off. With all these vaccines being so new, how do we know that there's not consequences or these side effects that could potentially show up 10, 15, 20 years after injection?
I'm just going to start this and then do my usual, hand it over to Michelle's expertise. But I need to be careful about framing everything that we talk about in terms of what is more potentially harmful, getting the disease or getting the vaccine. And if you don't do that, then you're not actually really weighing your choices appropriately, right? And so if we're talking about issues about long-term symptoms like long COVID or things that really haunt your body for a long time, you better really know about the ways in which the actual illness itself, COVID-19, can cause those problems and those symptoms. Being that the virus can be so aggressive in different bodies and sometimes in ways that you can't predict, every organ in your body, including your reproductive organs, can be at risk from having some effects from having the virus itself. And if you're really doing that kind of, which is the riskier, which is the safer, which is the most likely to have my child have lifelong health and wellness, then the vaccine wins out in that way every time. Again, I wish you could say we know everything we need to know, but we're going to keep learning about things in different ways. What we can say with confidence right now, though, is for any kinds of symptoms that you're worried about, getting sick with the virus is worse than getting the vaccine.
Mm-hmm. Yeah, exactly.
Oh, I'm sorry.
Yeah, no, I said exactly. And I mean, if we go back to my analogy of the garden, when you bring in the master gardener, they do the work and then they leave. They're not hanging around because you're not paying them to hang around. They've told you what you need to do, and then your body does it and they leave. And there's no precedent of long-term negative impact for vaccines. And I think that for me, that says a lot.
Like you said, this kind of mRNA vaccine has been used in other conditions. So we do know a little bit more on a longer term from this style of vaccine than just these last 2 years or almost.
I think that one of the things that you've touched on is that risk, comparing the side effects and the long-term health consequences of getting sick versus the vaccine. one of the questions that we got at registration, and it very much mirrors what I've heard, is that there's a relatively low frequency of severe illness or death from COVID-19 among children. So I think it's easy to look at this, and especially look at comparatively to older people. But COVID-19 really hasn't touched children in the same way. But while it hasn't in death, is it in illnesses more than we're maybe not seeing?
Well, I mean, we're a big country, right? So small numbers actually small percentages turn into actually decent sized numbers. So we're heading well past, I think we're at 12.6 million kids now have been diagnosed with COVID since the beginning of this pandemic. So that's not a tiny number. That's a lot of the kids getting sick. The second thing is, during peak times, we're just a month away from the sort of late November, December, early January time when nearly 1,000 kids a day were being hospitalized in this country. That's not a tiny number. That's a significant number. And so that's hospitalized. That's sick enough to need to go into the hospital. The other things, of course, which Michelle has said, and I'll just repeat, is that we have so many more things to think about in terms of protecting the other people that our children are around as well. If we want to be able to have that time with grandma, and if we want to be able to feel like that the schoolmate with chronic disease or immune system concern is also safe, then that's also part of the things that we need to balance all in our heads.
Yeah. And I would just add to that, as a parent, the last time I gave a lecture on pediatric deaths, which was in December, the number for deaths in the US was 630 deaths among children. And, you ask the parents and the loved ones of those 630 children if that's a small number, and the answer is definitively no. There is no acceptable death rate, I would argue, for the children in this country or any other country. And many of those children had no pre-existing conditions, were in good health, and I think that that is scary for any of us, and particularly scary if your child has a pre-existing condition and is immunocompromised, and feeling like you can't protect them. So I think it's all relative. The numbers are fairly small when you compare them to adults, but is the loss of over 600 children really acceptable?
I think a particularly interesting no, I'm going to say. I will answer that question. But Dr. Danielson, I think it's also really interesting that you had said it was 12.9 that had been diagnosed with COVID children.
Yeah, I think it's 12.7 right, as of this past week. Yeah.
And given that we know that this long haul COVID comes up periodically in a person, and their recovery can have these ebbs and flows for a period of time. And I think it's a really interesting question of how long is long haul COVID, which I don't know that we have an answer to yet, because we just haven't gone far enough.
Right.
So I feel like a whole nother talk we could have is, what's this ripple effect into our future of the healthcare system in our country, given the millions and millions of people that have had COVID and the potential for this long haul COVID.
Yeah.
That might be another conversation.
Mm-hmm. And the economic impact. I mean, there was an article that came out of the UK that looked at their employable population, and about 1% of their workforce was unable to work at a certain point. I forget when that came out in the in Lancet, and it was really, very telling. And that was prior to Omicron, and may have preceded Delta even, that they had like 1% of their population that was just not able to work. That's a pretty large percentage. I mean, it's small, but it's still like fairly large if you think about the impact of long haul COVID on your ability to show up for work.
That's so true.
And as we've seen with supply chain in general, even a 1% impact can have impact through manufacturing and transport and through all processes of our economy. So it definitely has an impact.
Yeah. And then when you think about the disparities that we've seen, among BIPOC individuals, they are overrepresented in that 1%.
Right.
So the impact on marginalized communities is even greater.
Such an important point.
Mm-hmm. Yeah, thank you so much for sharing that aspect too, as we go back to community, this idea of community. We have a question about if your under five years old child was recently sick with COVID, is it best to vaccinate them now as soon as they're eligible, or is it best to wait a little bit, especially given there may be another variant of concern that could emerge in the future?
I think the overriding guidance is to vaccinate them as soon as they're eligible for the vaccine. It gets into a pretty difficult game of trying to predict when that sudden risk might show up. And we saw the wave of Omicron kind of come up pretty fast on us. So following, I think, the overall guidance is probably the best path, and that's what I would recommend.
Yeah, Omicron's a great example.
My video froze. Am I still here? I'm sorry about my video. I don't know what's going on.
You are here in voice, okay, but not in vision.
Okay.
Great. I'm glad that you were still with us.
Yes.
Yeah, I think Omicron's a great example of it did come up really, really fast. And so good to brace ourselves that another variant could also appear quickly. And so get the vaccine when you can. A minute ago, you were speaking to just the disproportionate representation of our BIPOC community in these numbers. Can you speak a little bit to the trials and the clinical trials and what work has been done? And maybe this is a little bit too meta of a question, but how do we ensure that these trials are representative of our entire population, especially for those that are sadly overrepresented to begin with in cases of illnesses?
Mm-hmm. Well, this was a main area of focus for my team and I. We, from the very beginning, we're working with all of the NIAID funded, or all of the US government funded, vaccine trials to ensure equity and inclusion in the trials. And that took, several, strategic approaches. One was, partnering with communities and with trusted voices and trusted institutions in communities to really ensure that we could get information out, not only about participation in trials, but also thinking long-term about acceptability and uptake of vaccines once they were available. And, some of the things that we did were to include diverse scientists and community members as part of the review of the clinical trial protocols and the informed consent forms, so that we could have discussions up front about potential barriers to participation and to identify some of the challenges that people might have in participating and identify ways to mitigate those challenges. So one of the things that we realized early on was that we needed to bring in a cadre of mobile van units for people who were not close to a clinical research site or were living in rural areas. So we quickly sort of got, like I said, a whole armada of mobile units to go out into communities. We also made certain that sponsors and our protocol teams were sitting down with community leaders and with tribal nations to talk about data ownership and data sovereignty. We partnered with the National Medical Association and the National Hispanic Medical Association, two of the oldest Black and Hispanic medical associations, respectively, in the country, and worked with them and Asian and Pacific Islander communities, blackdoctors.org, to do listening sessions, town halls, and we also engaged in a pretty extensive marketing campaign that was really information and education based. And all of those efforts at the end of the day resulted in, across our CoVPN sites, and this isn't including the commercial research organizations, but across the CoVPN sites, 47% of participants recruited identified as Black, Indigenous, or a person of color. And I think personally for me, it shows that not only is it possible to do this, and the disparities that we see in terms of people who are participating in clinical trials can be addressed, but it also shows that, you know, community really needs to be centered, and relying on community organizations, community resources that are already there but underfunded or underutilized is really, really critical in addressing public health problems across all communities, not just for some, but for all of us. And if we are going to have optimal public health, we need to ensure that everyone is receiving the best health care possible, because we are only as strong as our most ill person in our network. And I think that COVID has hopefully shown us that. Oh, I'm back.
It's beautiful timing for your camera to come back on.
Yeah. I so appreciate, I could just tell your voice changed when you were answering that question in a way that lets me know how meaningful that is to you. And it makes me want to just say, there can be so many different feelings about what our communities need and how our communities have been wronged by healthcare and science historically, and the very justifiable concerns that different communities might have. So I celebrate the communities, Black and Brown communities, holding science and healthcare's accountable to actually doing things differently now than would have been the way things were done even a few years ago. That's a two-way street. That is community speaking up and speaking loud and speaking proud and stepping into a space and saying, we expect something different now. And it's also science and healthcare responding and doing everything they can to be responsive to that. And I think that continues into also the strategies and the ways that you go from making a bunch of vaccines to actually making them available and getting those jabs, as they say, out there. And there've been some remarkable partnerships. There's been a collaborative something cool about people working together of over 600 different community-based organizations around this state, some of them focusing on LGBTQIA rights, some of them focusing on adolescent runaway, unhoused youth, some of them focusing on Black communities, some of them focusing on immigrant communities. And really, they've been creating the solutions in terms of distributing and connecting. And maybe it's the Spanish language radio station in the Yakima Valley. Maybe it's the Ethiopian Center in the Rainier Valley. Maybe it's the Disability Rights Center, where people know that folks are looking out for them. It's been communities that all along that have been pushing us to do better, and that have been really stepping up in different ways to make sure that we all have the opportunities that Michelle's talking about.
Yeah, and I think that's such a critical point, because, you know, one of the common areas of discourse that has really bothered me throughout the epidemic, and even throughout the pandemic, and even prior to that, is you know, this idea that you know, communities of color, marginalized communities, specifically Black community, has, like, you know, trust issues, or they're so mistrustful. And I think, you know, we need to flip that around as researchers and really think about what are we doing to build our reputations of trustworthiness. Right. You know, part of the reason why these community organizations are so effective and so responsive is because they have relationships that are based on trust, are based on reciprocity and empathy and understanding of what people are going through. And I think that as scientists, we really need to think about how we can better build relationships with community to ensure that we have reputations of trustworthiness, and we have, you know, good patient provider, patient or participant provider, whatever the relationship is, you know, that we have like a good bond between the provider and the recipient of care. And I think that is really an area where I've seen a lot of growth, and really requires a lot more growth.
So well said. And just to dispel one more myth, I saw a study recently looking at the folks most negatively impacted by COVID, which are BIPOC, Black and Brown communities, to a greater degree than other communities, and that those are also the same communities that are actually more likely to abide by safe practices, masking and hand washing, and all of the things that help to keep us safe. So I just think I so appreciate, Michelle, that we're not marketing those stories that are not true about us anymore. We're telling more of the truth, and I think that's really important.
Yeah, no, it is. It's so true. You know, and that just reminds me of you know, an incident that happened very early on in the pandemic. You know, we sat down with the president of the Navajo Nation, and they were one of the first sovereign nations in this country to really take the preventive measures really, really seriously. You know, they had a curfew that they put in place. They were locking down their borders. They were ensuring that people were wearing masks indoors, that they were physically distancing, because, you know, Native people know what it means to lose people from disease and infection. But the reality is that their reservation is largely a food desert. Yeah. So you need to leave the reservation to get food, to get supplies, and the neighboring towns surrounding the reservation were not abiding by these, and actually were not having any precaution in place, masking or anything. And so what happened very early with the Navajo Nation is that the peoples in the Navajo Nation were infected by leaving the res, bringing it back in, and then you see this huge explosion of infection. And to date, Native and Indigenous peoples have one of the highest hospitalizations and death rates, even with their, very, very responsible actions from the very beginning of the pandemic. So yeah, I cannot. I think what you're saying is so true on so many levels, and again, it goes back to protecting those around us. It's not just about us. It's about all. It's not about me. It's about all of us.
So well, beautifully said. And thank you so much for bringing it to, again, not just as the individual, but also for our community, and really thinking of community with a capital C community. It's everybody. It's our entire network. It's everybody around us. It's everybody we interact with. And the example you just shared, it's the people in the neighboring town that also have that big impact on our community. We've touched on so many topics tonight, from just vaccines and the clinical trials, health inequities, BIPOC people in our community, and disproportionate health impacts to them. For people who want to learn more, what's your favorite resource, podcast, book, article, information source that you like to share on any of these topics tonight?
Well, I'm biased, so of course I'm going to say the COVID-19 Prevention Network. So I think we've done a really good job, and we work in partnership with our communities to make sure that we are using appropriate and respectful language that's comprehensive. But I also think, that the Johns Hopkins University and their COVID tracker is really amazing. And that's one of my go-tos. I think that they've done a phenomenal job, not only with US data, but really have a global view, and again, as a country, we are only as safe and as healthy as the countries around us. And so I think having a global perspective of what's going on in terms of incidence and prevalence, and also vaccine uptake is really important to know, like, what our reality really is.
So I was a fiend of that site for the longest time. And I think I would just add to that, if I'm speaking to a parent, I want to say to them that you've really developed a relationship with a provider, and you've placed your trust in that provider for many things that are really important about the well-being of your child. It's the person that you've wanted to get advice about developmental changes and different forms of stress and how to understand behaviors. And there's a provider that you've put a lot of faith in, possibly well before there was a coronavirus in our midst. And do the websites, do your research, and then talk to somebody that you feel is trustworthy in the healthcare system. And that's probably the person that you've trusted your child's health with for quite a while. And we need to know. We need to be able to look somebody in the eye and say, what's the best path? And we need to know when we're looking them in the eye that they have our child's best interest at heart. That's just the way we work, right? We need the data, but we also need to know, just through that connection, that we're having a meaningful conversation about things too.
Yeah, that's such an important point. So true. As a parent, yes.
Yeah, we've definitely seen in a different light those importance of community and relationships over these past 2 years. It's really thrown into light, I think, what our networks look like and what our relationships are, and trusted sources for information. And I cannot express the thanks that I have for Dr. Danielson and Dr. Andrasik, for the both of you being part of our network at Pacific Science Center, and for everybody who's tuned in to join us tonight. A wealth of information, some food for thought. And I really hope that everybody tuning in has enjoyed tonight's program. We'd love to hear your feedback. So please take a moment to complete a short survey, and we will put the link in the chat. You can sign up for our e-newsletter to learn more about our upcoming programs at pacsci.org/newsletter sign up. And we've got some additional resources as well for you. So if you'd like to learn more about vaccines, including the development and trials of vaccines, check out our YouTube page for a video series that was created by the fabulous creative minds of the scientists working locally here at Bristol Myers Squibb. These videos explore a wide variety of healthcare and research topics. I believe there's even one featuring you, Dr. Danielson. So check out that video series to learn so much about, through the lens of cancer research, but also vaccines and communities and community health. Remember, this talk to review can be found on our PacSci YouTube page. And I just want to thank once again all of you for joining. Dr. Andrasik, Dr. Danielson, thank you both so much for not just joining us tonight, but for all the work and passion that you've brought to your work for so many years to help make our communities more healthy. And I look forward to seeing you in the future in person at some point for another event. Thank you both very much.
Thank you.
Such an honor to be
honor.
part of this.
Yeah, always an
thank
honor.
you, Pacific Science Center, for always being a light that shines bright for our young people, especially. And every one of us is kind of a young person at heart. So you're a treasure. Really appreciate you. And Dr. Andrasik, man, my admiration grows just every time I hear you speak. So thank you.
Same. Always an honor to share the space with you. Thank you so much.
Thank you both. Have a great night, everybody.